Hair transplants. What to expect? Like good health and youth, most of us take our locks for granted, that is, until they're gone. For many people, a hair transplant can help bring back what looks like a full, or at least a fuller, head of hair. If thinning up top or going bald really bothers you, the procedure can be one way to feel more confident about your looks. But first, talk with your doctor about what you can expect during and after the surgery. What is a hair transplant? It's a type of surgery that moves hair you already have to fill an area with thin or no hair. Doctors have been doing these transplants in the US since the 1950s, but techniques have changed a lot in recent years. You usually have the procedure in the doctor's office. First, the surgeon cleans your scalp and injects medicine to numb the back of your head. Your doctor will choose one of two methods for the transplant: follicular unit strip surgery, FUS, or follicular unit extraction, FU. Continued with FUS, the surgeon removes a 6 to 10 inch strip of skin from the back of your head. They set it aside and sews the scalp closed. This area is immediately hidden by the hair around it. Next, the surgeon's team divides the strip of removed scalp into 500 to 2,000 tiny grafts, each with an individual hair or just a few hairs. The number and type of graft you get depends on your hair type, quality, color, and the size of the area where you're getting the transplant. If you're getting the FU procedure, the surgeon's team will shave the back of your scalp. Then, the doctor will remove hair follicles one by one from there. The area heals with small dots, which your existing hair will cover. After that point, both procedures are the same. After they prepare the grafts, the surgeon cleans and numbs the area where the hair will go, creates holes or slits with a scalpel or needle, and delicately places each graft in one of the holes. They'll probably get help from other team members to plant the grafts, too. Depending on the size of the transplant you're getting, the process will take about 4 to 8 hours. You might need another procedure later on if you continue to lose hair or decide you want thicker hair. Expectations and recovery after the surgery: your scalp may be very tender. You may need to take pain medications for several days. Your surgeon will have you wear bandages over your scalp for at least a day or two. They may also prescribe an antibiotic or an anti-inflammatory drug for you to take for several days. Most people are able to return to work 2 to 5 days after the operation. Within 2 to 3 weeks after surgery, the transplanted hair will fall out, but you should start to notice new growth within a few months. Most people will see 60% of new hair growth after 6 to 9 months. Some surgeons prescribe the hair-growing drug minoxidil, Rogaine, to improve hair growth after transplantation, but it's not clear how well it works. Risks and costs of treatment: the price of a hair transplant will depend largely on the amount of hair you're moving, but it generally ranges from $4,000 to $15,000. Most insurance plans don't cover it. As with any kind of surgery, transplants have some risks, including bleeding and infection. There's also the chance for scarring and unnatural-looking new hair growth. Around the time new locks start to grow, some people have inflammation or an infection of the hair follicles, called folliculitis. Antibiotics and compresses can relieve the problem. It's also possible to suddenly lose some of the original hair in the area where you got the new strands, called shock loss. But most of the time, it's not permanent. Talk with your doctor about these risks and how much improvement you're likely to get from the surgery. They can help you decide if it's a good option for you.